Every child deserves a healthy start, but today, more babies are being born into pain than ever before. Cancer at 2 years old, diabetes at 5, asthma, seizures, heart defects, before they even speak their first words. Why? The answer is not just genetics. It's what we're doing before, during, and even after pregnancy that's silently harming our children. Welcome to another lecture from H-Medics. I am Dr. Sarah. Please subscribe to the channel as a form of support to what we do. Thank you. This is not to cause fear, but to awaken responsibility. We're going to break down the uncomfortable truth, how modern parents, often unknowingly, are exposing their unborn babies to a world of disease through their own habits, environments, diets, and mindsets. If you're planning to become a parent, or already are one, this message is not just important, it's life-saving. 1. Processed foods and poor diets. Let's start with what we eat. Today, many pregnant women rely heavily on processed foods, fast food, sugary snacks, soda, refined carbs, and canned meals. These are loaded with preservatives, artificial colors, excess sugar, and harmful fats. What's worse is that these foods lack essential nutrients the baby desperately needs to develop a healthy brain, heart, and immune system. Low folate is linked to neural tube defects. Low omega-3s is linked to poor brain development. Excess sugar increases risk of childhood diabetes and obesity. As Dr. Joel Fuhrman states, the womb is where we set the foundation for a child's lifelong health. It is not a time to feed on convenience. It is a time to nourish deeply. 2. Smoking, alcohol, and drugs, even in small amounts. Some people still believe that a little wine or just one cigarette during pregnancy won't hurt, but the science is clear. Even small amounts of alcohol or nicotine can damage fetal development. They increase the risk of childhood cancers like leukemia, heart defects, brain malformations, and learning disabilities. Illegal drug use? Even worse. Cocaine, opioids, or cannabis during pregnancy are linked to premature birth, low birth weight, and developmental delay. Every choice a parent makes during pregnancy sends a message to the baby's cells: grow strong or struggle to survive. 3. Environmental toxins in everyday life. We live in a world drenched in chemicals. Pesticides on vegetables, plastics leaching into water, air fresheners, cleaning sprays, makeup, hair relaxers, skin lightening creams, all filled with endocrine disruptors and carcinogens. Many of these chemicals can cross the placenta and enter the baby's bloodstream. A 2023 report found over 150 synthetic chemicals in umbilical cord blood, including flame retardants, BPA, lead, mercury, and phthalates. These chemicals disrupt hormones, damage DNA, and increase cancer risk even before the child is born. 4. High maternal stress and emotional trauma. Stress is not just a feeling, it's a hormone. When a mother is under constant stress, her body floods with cortisol, a chemical that can reach the unborn child. This affects brain development, immune function, and emotional wiring, raising the child's risk of anxiety, ADHD, autoimmune disease, and even diabetes. Unresolved trauma in the mother, it can be biologically passed to the child through a process called epigenetic inheritance. Dr. Gabor Mate warns, the womb is not only a place of physical growth, but emotional programming. A stressed pregnancy can give birth to a stressed child. 5. Sedentary lifestyles and lack of physical movement. Regular, gentle exercise during pregnancy increases oxygen flow to the baby, improves metabolism, and reduces inflammation. But today, many mothers spend long hours sitting, on screens, barely moving. This lack of movement is associated with gestational diabetes, high blood pressure, and poor fetal circulation, which can lead to complications in the baby like insulin resistance and birth defects. 6. Overuse of medications and supplements. Some parents overload on medications and supplements without proper medical advice, painkillers, antibiotics, and even herbal remedies that may not be safe in pregnancy. Paracetamol, acetaminophen, for example, has been linked to developmental disorders when overused during pregnancy. Supplements like vitamin A in high doses can cause birth defects. The rule is simple. If it goes in your body, it goes into your baby's body too. Consult a doctor every time. One of the biggest mistakes we make? Waiting until pregnancy to start caring. The truth is, the first 1,000 days of a child's life, including the 9 months in the womb, are the most critical window for long-term health. Fathers matter too. A father's alcohol use, smoking, obesity, and stress levels can affect his sperm and the future health of the baby. It's a team effort, a conscious commitment, and it starts long before the pregnancy test turns positive. This is not about guilt, it's about awakening. Yes, cancer, diabetes, and other childhood illnesses are tragic, but they are not always random. We have the power to shift this epidemic. With cleaner diets, lower stress, safer environments, and early education, we can prevent disease before it starts and give our children the health and future they deserve. Because prevention doesn't start in the hospital, it starts at home. If this video opened your eyes, share it. Let someone else learn the truth.